His own advice about not going out on a Sunday morning is the Health Secretary, Matt Hancock. Mr. Hancock, welcome. Thanks for joining us. Can I ask, first of all, is the NHS close to being overwhelmed?
Well, the NHS is under very serious pressure, as the Chief Medical Officer said. It's probably under the greatest pressure it ever has been. And that's particularly true in some parts of the country, but frankly, it's true right across the UK, and we all can do something about it. You know, the NHS has never needed everybody to do something more than it's needed that now, and that's to stay at home.
Your phrase has been in the past overwhelmed. How many weeks away are we from the NHS being overwhelmed?
Well, if everybody stays at home, and unless they absolutely have to leave, if everybody does that, everybody follows the rules, then we should see the case rates start to come down, and we should see that pressure start to abate. And so it depends. The answer to the question, frankly, Andrew, depends on what people do. And I think that the message is extremely clear, which is unless you have to, you should stay at home.
So when we come to what that big word overwhelmed actually means, what would it mean? We've got stories this morning, for instance, of ambulances having to wait for 9 hours before they decant people into hospital. And we've had lots and lots of stories about what's going on inside hospitals. What would overwhelming the NHS actually mean?
Well, at the moment, even though it's incredibly difficult, people are able to get the care that they need. And that's one of the wonderful things about the NHS is that it is a promise to all of us that we can get the care that we need when we need it. And it's universal. It's for everyone, according to need, not ability to pay. Now, this team in the NHS, colleagues right across the board, are working incredibly hard to deliver that right now. And, you know, you've seen some of the stories from not just from emergency departments and intensive care units, but across the board, ambulance services, like you say, people working incredibly hard to make sure that people get that care. We'll open the Nightingale hospitals as needed. We'll make sure that we expand capacity. We've built extra capacity this summer. But ultimately, we've got to get the cases down so that people can continue to get that care.
We've got nurses and doctors on their knees with exhaustion. If the worst happens and the system can no longer cope properly, does that mean also that the vaccine rollout will be affected? Because we're relying on the same nurses and the same kind of facilities to help put the jabs in people's arms.
Well, clearly the NHS got so much on, and this is why it's under so much pressure. Really, 3 huge projects. One is looking after people who are ill in hospital with COVID, over 30,000 people. The second is rolling out the vaccine. Now, primarily, but not entirely, that's being done through GP surgeries and these new vaccination centres that we're opening this week, rather than through the hospitals, although hospitals are also vaccinating. But the large majority will be done through primary care, through GPs and communities, pharmacists, and these big centres. And then the third job the NHS has got on is everything it normally does. And if you think about it, at this time of year, the NHS is normally under pressure, even without those 2 huge additional tasks. So, you know, my gratitude, all of our gratitude, goes out to the team working across the NHS, and it is working harder than it's ever worked before. And we can all do something to help, which is to stay at home. Because every time you try to flex the rules, that could be fatal. And we all.
I'm sorry to jump in, but this sounds to me as if you think people are flexing the rules, and you're worried that people are not observing all the rules as stringently as they ought to be.
Well, I think the vast majority of people are following the rules, and the data show that most people are staying at home, but you can see, it's hard. It's not easy. As
compared to March,
the professor just said, it's not easy. But if you can do something from home and you don't need to go outside of home to do it, then you should. You know, things like I'm here at home this morning. I normally like to come into the studio because you have a chance of a more in-depth interview somehow. But actually, let's just stay at home and do it from home because you can. And this is just one tiny example of the plethora of examples that there are of where people just need to not just follow the letter of the rules, but follow the spirit as well and play their part. I know it's tough.
And in that same spirit, a very straightforward question: do you know whether people are following the rules that they've been told about in the same way and as stringently as they were back in March?
Well, we don't know because we didn't have, frankly, the data and the surveillance systems back in March when all this had to be brought in at such pace. But we do know that people are being more stringent than in the November lockdown, and that's important.
Yeah. But that's not really the right. So, yeah, that's not really the appropriate parallel. And you do know, for instance, about traffic, and certainly there's been figures bandied around saying that the amount of traffic on the roads, the number of people in the underground, the number of people using buses is far, far higher now than it was in March.
Well, there are signs that people are doing well. As I say, the data that we do have that's in detail shows that people are staying at home more than they were in November, and in a way, the comparison to March, what really matters is that people do follow the rules, because we're seeing that pressure on the NHS. And also, I would say, Andrew, although the comparison to March would be useful, we have a new variant that passes on so much easier
we have
in March.
We have a new variant, and the measures are more lenient than they were in March. So if this doesn't get under control, and a lot of people in the NHS think you have lost control at this stage, if this doesn't get under control, what new measures could you introduce?
Well, obviously, we look at the data all the time and are constantly looking at what is the right thing to do. But at the moment, the very clear message is that people need to stay at home. The government rules only are one part of this. What really matters is what every single person does, because that's how the virus spreads. So, obviously we keep these things, we're vigilant, but what really matters is how everybody watching this programme behaves and how, minimising the social contact.
And because you've said it so many times already, I do take it that you are worried about compliance. But of course, the government rules are also absolutely central to this. So are you considering, I'm not saying taking a decision on, but are you considering things like curfews, closing nurseries, ending some of those support bubbles, going back to only an hour of exercise outside, and telling people in crowded outdoor spaces to wear masks? Are those the kind of things that you could consider if you don't get this under control very quickly?
Well, I don't want to speculate, because the most important message is not whether the government will further strengthen the rules. The most important thing is that people stay at home and follow the rules that we've got. And that is, in terms of the scale of the impact on the cases, that is the most important thing that we can do collectively as a society.
Now, one of the reasons that maybe people haven't been staying at home enough is because they're not getting the financial support they need. Is the government going to look at helping further people who simply lose an immediate cash income as they stay at home? Because not everybody is covered by your scheme.
Well, we've got the most generous schemes that have ever been in place in the UK, and some of the most generous schemes that are there in the entire world. And the IMF, for instance, has looked at these economic schemes and has compared them and has complemented the schemes that we've put in place here in the UK. So obviously, again, we're always updating those. You'll seen after we announced the lockdown, the Chancellor of the Exchequer announced further support. Of course he did, because this is a massive national effort. We have these very generous schemes in place.
If we look at somebody who's been told to self-isolate for 10 days, an average worker, according to the TUC, that person would lose £690 straight away in earnings. It's a huge disincentive, and maybe part of the reason that you are struggling to get your message over.
Well, I think that's if I may say so, only a partial way of looking at it, because we have the £500 support payment for people on low incomes. People on higher incomes often, well, usually find it easier to bridge and are more likely to be in jobs where you're paid at full salary if you're sick. So I think targeting
7 out of 10 people don't qualify for that, Minister. 7 out of 10. Most people don't qualify for that.
And that's all about targeting support at those who need it most. So we're targeting support absolutely at the 1 in 3 people who, or the 3 in 10, if you like, who need it most, and are most likely to find it difficult to follow the isolation rules if they don't get that financial support from the government. So that's in a way that you answer your own question, which is absolutely we have a targeted approach.
Well, let's look at some of the things that you are doing to try to get this under control. You've made a big announcement about the number of tests of asymptomatic people in the community. Are these the same lateral flow tests that you know from Liverpool won't give you enough accurate results?
They're the same lateral flow tests that worked effectively in Liverpool, yes, where the science is really clear, which is that if you have a test and we find more people who have got the disease, we're able to break those chains of transmission. And some people do need to leave home in order to go to work. And so we want to put testing in place, especially for those people, to try to make going out to work as safe as possible and to find as many positives. The good news about these tests is that they're really easy. They're easy to do. They're easy to administer. You get the result back more or less immediately within half an hour. And that means that we can find far more people and get these tests out to far more people. And the science on them is really clear. We've published all of the data on how effective they are.
You say the science is clear and this is good news, but in Liverpool, 60% of positive cases were missed by these tests. And the scientists reported back to you from Liverpool, they said, the analysis does not provide any clear indication that mass asymptomatic testing had an impact on the trend in cases or on the trend in hospital admissions in Liverpool during the period. So there's the less good news. They're simply not good enough.
But also that's not the assessment. And
it's from your own. It's from your own paper. It was your own scientists to you.
What happened in Liverpool was that with this mass asymptomatic testing, we saw the case rate in Liverpool fall more sharply than it did in other similar areas where only the restrictions were brought in. And of course, you've got to get the testing as targeted as possible, and it only ever can be one tool in the armory. But nevertheless, it brings a significant additional benefit if you can identify those cases where you wouldn't identify them otherwise.
I've just read you your own scientists saying exactly the opposite. But let's move on. Let's move on to the vaccination programme itself. How many people have been vaccinated so far?
Well, we're going to publish the daily data from tomorrow. The good news is that over the last week, we've vaccinated more people than in the entirety of December. So we're accelerating the rollout. It's increasing.
How many? Can you give me a figure?
Well, it's around the 2 million mark, but we're going to publish the exact figures tomorrow and then henceforth on a daily basis. The good news is that we're getting to over 200,000 people a day is significant progress. And amongst those who we need to reach most, amongst the over 80s, we've now vaccinated around a third of all of the over 80s. So very, very good progress.
Let's talk about the exit strategy, because the two things are very closely connected. Sir Peter Horby was saying on this programme a few moments ago that, yes, you do have to vaccinate people in their 50s and their 40s before we get out of this. In other words, simply vaccinating the most high-risk group, the oldest people, is not enough, to use your phrase, to cry freedom and get out of that. That is over-optimistic boosterism. You have to vaccinate many, many more people down the scale. And indeed, the inventor of the Pfizer vaccine said you had to vaccinate everybody by the autumn. Are you going to be able to do that?
Yes. So we're absolutely going to...
Everybody will be vaccinated by the autumn.
Every adult will be offered a vaccine by the autumn. Absolutely. I totally agree. It's very, very important. So, of course, you've got to do it according to need. because somebody in a care home, for instance, is many times more likely to die if they catch coronavirus than somebody like me in my 40s. But absolutely, we're going to offer the vaccine to everybody. We've got over 350 million doses on order. They're not all here yet, and we're rolling them out as fast as they get delivered. But we are going to have enough to be able to offer a vaccine to everyone over the age of 18, and by the autumn. Now, I really hope that everybody will take that up. And the take-up so far has been absolutely fantastic. And the take-up of the flu jab this year has been over 80%. So 4 out of 5 people over 65 taking the flu jab, which is good news and a good indicator. But yes, it's very important that, of course, we start with the most vulnerable, but then we get through and we vaccinate everyone.
Now, almost everybody that is watching this programme right now wants to know about the exit strategy, when this is all going to start to change and lift. You have said, as a government, absolutely that schools will be the first thing to reopen. Isn't it now the time to be absolutely clear with people about the criteria on which you will take that decision? Does the R number have to be below 1 before schools are reopened? What has to happen to community transmission before schools are reopened? If you tell people now what your thinking is, then you have much more trust going forward when that decision is taken.
I think that's fair. So we've set out 4 conditions. The first is that there shouldn't be a major new variation in the virus itself, because we all know how much more challenging this has become with the new variant. The second is that we obviously need to see the vaccine rollout proceeding effectively, and it currently is. It's going very well, and we've got the new vaccination centres opening next week. The third is we want to see the number of deaths coming down. Of course, we all do. And because the number of deaths is highly concentrated in the most vulnerable group, more than 4 out of 5 deaths have sadly been amongst the over 70s and the clinically extremely vulnerable, who are in those top groups who we are going to vaccinate by mid-February. That means that I hope we can see the number of deaths coming down once we've got those vaccines done, and the 2 to 3 weeks afterwards that it takes to get the immunity. And then the fourth condition is, of course, the pressure on the NHS. And we can see these very significant pressures on the NHS right now. It's always challenging in the middle of winter, but this is like no other winter before. And obviously, we want to see that pressure reducing as well. So those are the 4 conditions that will follow. By the middle of February, by February the 15th, our goal is to have offered a vaccine to everybody in the top 4 most vulnerable groups, which is the over 70s, the clinically extremely vulnerable, the care home residents and elderly care home residents and their carers, and NHS and social care staff. Now, we're on track for delivering that. But then it still takes weeks after that, 2 to 3 weeks for them to get immunity. And during that time, we'll keep going down the age spectrum. And we want to get to all the over 50s by the spring, and then keep vaccinating all the way through to everybody over the age of 18. So that's the plan. I would like to put more precise timings on when the restrictions can be lifted, but unfortunately, as you know from the discussions we've had many times, you just can't do that. We've got to track that data and see how things progress.
We've been talking about schools. Was the Prime Minister right to say on this programme last week that primary schools in England were safe?
Yes, and the Prime Minister's been yes.
But they're also vectors of transmission. How can a vector of transmission be safe?
Well, I'm going to explain again, as he did on this programme last week. I think he was very clear, which is that schools are safe for the children in them. And there's no evidence that teachers catch COVID any more than any other profession. However, in the same way that for adults, around 1 in 3 people catch the disease, don't know they've got it, they're asymptomatic, but they can pass it on. So children can be safe, yet still have the disease asymptomatically, and therefore pass it on. Well, so he was very clear about it. If you watch back to last week, Andrew, he was very clear about how schools are safe for children. However, they still add to and contribute to the spread of the disease, hence the decision that we've had to take.
It's just quite confusing to people if children are passing the disease around and causing more illness and ultimately more deaths. It doesn't seem very safe. Nonetheless, let's move on.
But it's safe to the children.
Safe for some people, but not for others.
It's safe for the children. I think if you watch back, I think people do understand this.
All right.
Actually.
Okay.
There are two parts to it, though. So to communicate it, it's really clear, as the Prime Minister was last weekend.
Final question on schools.
Safe for the children. So children of key workers. If one of the parents is a key worker, then the children can go to school. And the children are safe in the school setting, and there's no evidence that teachers are any more at risk than the rest of the population. However, schools still, contribute to the spread of the disease, hence the decision that unfortunately we had to take last week.
So at the moment, some schools have 50% of their normal capacity in school because of those exemptions. Doesn't that mean that schools are going to have to wait even longer across the rest of the country to reopen? Isn't that going to keep things going faster?
Well, you've got to keep schools open for the children of key workers. Of course you do. And we've set the criteria out very clearly for who those key workers are. But you've got to, I need the schools open so that NHS staff can get to work and to look after people. In the same way, we need the critical services of this country to continue to run. Having said that, of course, everybody who can work from home should work from home. But it's really important that we still have people coming into work. I mean, the NHS would be under even more pressure if you didn't have that. And so these are difficult balances, but it's very, very important that schools do remain open for those key workers.
We're almost out of time, so I'm going to ask you for a quick question. Your former Culture Secretary, were you pleased to see Twitter banning President Trump?
Well, what I would say is that I think that, firstly, obviously, the scenes clearly encouraged by President Trump, the scenes at the Capitol were terrible, and I was very sad to see that, because American democracy is such a proud thing. But there's something also that's changed, which is that social media platforms are making editorial decisions now. That's clear, because they're choosing who should and shouldn't have a voice on their platform. Now, I think we should just be straightforward about that. Now, it has consequences, and they're very much, as you say, for the culture department, not for me. But I think that those scenes in America were really, really were really upsetting. Anybody who believes in the values of democracy.
Sure. I think in terms of pleased or not, that was a rather lengthy and serpentine yes, if I may say so. Matt Hancock, thanks very much indeed for joining us